I have the privilege of working with Dr. Maloney at the Fred and Pamela Buffett Cancer Center. But give you a nice introduction for you. Dr. Maloney is an assistant professor in the Department of Epidemiology at UNMC's College of Public Health. He is also the assistant director for community outreach and engagement for the Fred and Pamela Buffett Cancer Center. I think that I get a chance to work with him there. And he is fantastic when it comes to data and numbers. And so today he's going to share a little bit in terms of different data resources that could be available to you all in a way that would help with the work that you're doing in any capacity. So let's give a warm welcome to Dr. Maloney.
Hello, everybody. Can you all hear me? Yeah, I got thumbs up in the back. That's great. Okay, well, so it wasn't that long ago that I was a student who was trying to figure out a dissertation topic, and I was getting really, really frustrated. I was looking at adult influenza vaccination in Louisiana, and I just couldn't find any data sources that were giving me background rates that I could use to generate some questions that I was looking at. And it wasn't until I discovered some publicly available resources that I was able to actually generate those rates. I mean, Google can only take you so far. So I'm going to try and take you past Google into some data sources that you can use that are very simple, point and click, that can get you data that are going to help you generate potential information for grant applications. So if you came here looking for a long PowerPoint presentation, you are going to be sorely disappointed. This is the one and only slide that I have. I am going to be doing some demonstrations of various publicly available data sources. And hopefully you will be able to use those data sources going forward in the future. On this slide, in 4 simple resources, I'm going to show you how to access data, and we'll share this slide with you so you can go ahead and click on the links. I wanted to give you a handout, but the links are like 100 characters long. So it doesn't make much sense for you to sit there and like look at a handout and try and click through things or manually input it. So with these 4 simple data sources, I'm going to show you how to access information on social determinants of health, health risk factors, health-related information, mortality, cancer, environmental data, and so much more. So we're going to start with the Nebraska Behavioral Risk Factor Surveillance System dashboard. How many people are familiar with the Behavioral Risk Factor Surveillance System? Show of hands. Okay, so about half of you. So the BRFIS has been conducted in Nebraska since 1986, so there is a wealth of data available. Essentially, the survey is conducted on an annual basis, and it's administered among the population here in Nebraska in order to collect data on health-related risk behaviors and events, chronic health conditions, and preventive services. Now, this dashboard put out by the Nebraska Department of Health and Human Services allows you to access all of that data in a point-and-click fashion without having to know anything to do with SAS or SPSS or R or STATA or anything along those lines. So no statistical background necessary. You can access all those data and get those background rates that you might be interested in for your grant applications. So in honor of my struggles getting influenza vaccination data, we're going to use that as the example here. So with 7 simple drop-down menus, you're going to be able to access the full power of the BRFIS in Nebraska. So we're going to leave the state of Nebraska as our geographic region. We're not interested in any subregions. I'm going to show you the totality of Nebraska. The health topic that we're interested in is immunization and infectious disease. We are going to see a whole bunch of immunization and infectious disease information for BRFIS. We're going to select flu vaccination, but you could just as easily access COVID-19 vaccination information, HIV testing, pneumonia vaccinations, shingles vaccination, tetanus vaccination. And the health topics, I didn't really show you all of these, but this covers everything from social determinants of health to behavioral risk factors to screening to preventive measures and services. And then you have the option of looking at adults 18 and over or 65 and older. We're just going to look at adults 18 and over. This is not letting me scroll, Fiona. Sorry, everybody. What would a presentation be without some technical difficulties? Maybe take it out of full screen.
Sorry, folks, give us just a second. We're trying to scroll, ladies. It won't let us scroll. So we're we're trying to scroll. I tried to open up the video. Yeah, there's no like scroll bar. Is this what you're doing?
Yeah.
Yeah.
Sorry. Do you want me to open up this on my computer?
Or I can do it, I'm on Zoom on my computer, I could try opening it on there. I could
Whatever
try-
works.
Okay, let's try it.
Promise it's worth it. Microsoft Edge, you should be using.
Website.
You think it's the website?
Well, I have it pulled up on my computer.
Is it on Microsoft Edge? Is that the problem?
What is this? Explore?
Yeah, or Explorer? Yeah, I think that's gotta be the problem. Oh,
I'm just making it smaller to see if we can, but it doesn't do anything but just make the
That's fine.
font smaller, but not the actual.
but visualizations are,
Can you still see what you
Present.
need?
yeah, it looks like it. I think so.
I want the other ones.
Oh, we'll cross that bridge when we come to it, I guess.
Okay, we'll work what we got.
All right, we're back. Sorry about that. Let me go ahead and reselect our drop down menus. Okay, so by selecting these drop-down menus, we are now looking at the proportion of people who are 18 and over in Nebraska who had received a influenza vaccination. So our vaccination rate is about 49%, which isn't excellent, but is kind of in line with the national trends that we're facing. So if you come up here, you can also access different years. So you can look as far back as 2011, but if I wanted to see the vaccination rate in 2021, I could do that as well.
Share your screen real quick.
Oh, yes, of course.
Sorry.
All right, great. Now, it would be kind of annoying to go through all of these years to try and look up influenza vaccination data if you just wanted to pull it all at once. Luckily, the dashboard here facilitates viewing trends over time. So if we wanted to look at influenza vaccination rates over time, we would just click the Trends tab, and then we could see influenza vaccination has actually increased by about 10% since 2011. So showing that we're doing some pretty good things here. Now, this dropdown also allows you to select different geographical regions within Nebraska in order to do comparisons. So the comparison subregions are going to be on the health department level because our counties, some of our counties are really small, having only a few hundred people. It would be too hard to generalize to those areas. So we're generalizing to the health district level. So if we look at Douglas County, for example, we could see that the Douglas County Health Department actually exceeds those rates and performs a little bit better. And if we wanted to look at one of our more rural areas, we could look at North Central District, for example, and we could see that they actually have lower rates. So already we're starting to see some urban and rural disparities emerge just by looking at this dashboard here. Now, we can also look at these distributions by different demographics. So if we wanted to see the sex breakdown or distribution, we could do that by just clicking the sex tab. And we could see that females are a little bit more likely than males to get vaccinated. We could look at age distributions. And we could see that the likelihood of you getting vaccinated increases as you get older, which makes sense. Our older populations are a little bit more vulnerable than our younger populations to those more influenza-related morbidity and mortality. And you can also see, you can do the drop-down menus with the health departments here as well. And you can see, again, that we are seeing some disparities for the North Central District Health Department here, where all age groups are getting vaccinated in slightly lower proportions. We can also look at racial and ethnic disparities in vaccination rates. And we can see that white non-Hispanics are getting vaccinated at a rate of about 48.3%, where Asian and Pacific Islanders are getting vaccinated at a rate around 65.2%. And now, in addition to those urban-rural disparities that we were seeing before, we can start to see racial and ethnic disparities emerging, where Black non-Hispanics, American Indians, multiracial non-Hispanics, and Hispanics are all less likely to be getting vaccinated than white non-Hispanics. By clicking on the income tab, we can also see that there are some economic disparities that are emerging in vaccination. The lower income you make, the lower likelihood you have of getting vaccinated against influenza here. And then you're going to see the same trends in education. We can also look at geographic related disparities here. Now, just by looking at the regions, we can look at all of the districts, all of the health department districts, and we can see all of the vaccination rates for 2022. And you can see where we're having higher vaccination rates and lower vaccination rates. And if you were to look at these, you would say that Douglas County, Lancaster County, and Sarpy-Cass are more urban counties within Nebraska, all have higher rates of influenza vaccination than our more rural health districts. You can also generate maps very easily here, and these maps can be exported to images or PDFs that you can include in presentations or anything else that you may want to include them for. Now, these again are broken down into local health department regions, and right now it's a little inaccessible in determining the vaccination rates, but by hovering over each of the individual departments, you can get the sample size information and you can get the percentage of people who were vaccinated against influenza. And on this map, the darker the color, the higher the proportion of people who were vaccinated against influenza. So again, you can see in our more urban areas, we're trending towards higher rates of influenza vaccination, and in our more urban or rural areas, we're trending towards lower rates of influenza vaccination. You can also look at the urban and rural divide, where we have all of those different districts aggregated into different categories. And those disparities that we've seen before are just as pronounced here as they were before. Those in urban counties are getting vaccinated in the highest proportions, and those in rural health districts are getting vaccinated in lower proportions. Now, if you just wanted to see a summary of all the data in the Nebraska BRFIS, you can just click the Summary tab. And in this situation, you don't have to go through and identify any specific data that you want to pull out on your own. It gives you all of the demographic data summaries. So the vertical line here is going to be the overall total for Nebraska. So you can compare across different variables this way. So you can see just in the sex variable, for example, you had a higher proportion of females who were getting vaccinated compared to males. And in age groups, the older you were, the more likely you were to be vaccinated. And this covers all of those demographic variables. You can also get a geographic summary. And this is going to be a comparison of all of the districts against the overall Nebraska vaccination rate. And again, you can see our more urban districts have those higher rates of vaccination. There are some additional resources at the bottom here that'll give you more information about the dashboard if you wanted to cite it, or if you wanted to get more information about the actual data sources. You can go directly to the BRFIS website, and this is going to give you information on the BRFSS and how it's conducted within Nebraska. And then if you go to the About the Data tab, the About the Data tab will give you more background on the BRFIS, but it will also give you an overview of the dashboard and all of the indicators contained therein. So this is really going to be where you want to go when you're looking for the sources of these data, trying to get additional context if you're actually writing these up. All right. So that's the BRFIS. Now we're going to move on to CDC Wonder, which is another excellent tool. All right, the scroll bar is back. We are all good. Right. So CDC Wonder is a easy to use menu-driven system that makes all of the information resources of the CDC available to public health professionals and the public at large. This provides access to a wide array of information, including vital statistics, mortality data, cancer data, data on the environment, population. It has the National Notifiable Disease Surveillance System incorporated as well, and the Healthy People 2010 survey. So for the purposes of our demonstration, we're going to look at mortality data, or causes of death. So if I go to the underlying cause of death, I am presented with a choice of choosing single race categories or bridge race categories. Now, the difference here is single race refers to data where individuals are categorized as belonging to only one race category, while bridge race is a method that's used to adjust data collected with multiple race categories to align with older data sets. So we're going to just select the single race categories here for the purposes of our demonstration. We'll agree to the terms. Now, the way that this menu is set up is you're getting 7 subcategories. You can organize the table layout, select the location that you're interested in, select different demographics that you may be interested in pulling data for, select the year and month. This is going to cover 2018 to 2022. If you don't select anything, this is just going to bridge all of those estimates together, and it's going to combine the populations for all years. Select weekday, autopsy, and place of death. We're not going to touch this. I don't know of any reason why we would want to look at different weekdays, for example, of death. You can select different causes of death, and then there are some other options that will allow you to export data, for example, show you 0 values and suppress values. So if we wanted to just quickly see the 15 leading causes of death in Nebraska, we could do that using CDC Wonder. So I would just start by selecting those 15 leading causes of death. And then I would come down and select Nebraska as my geographic location. Now, I'm not going to touch any of the other sliders for now. We're just going to go ahead and see those 15 leading overall causes of death. So we can see here from 2018 to 2022, these are our 15 leading causes of death, led by diseases of the heart. It gives the ICD codes that are relevant to those conditions that are included there, and ending with septicemia. But we can see some really interesting things emerging, like COVID-19, for example, diabetes, Alzheimer's disease, influenza, and pneumonia. So we're seeing some infectious diseases with our chronic diseases. So if you wanted to go back to the request form, you would just click request form up here in the corner, and we can make some modifications to generate some new data for us. So if we wanted to look at specific causes of death for select demographic groups, we could do that using the demographics tab. So if I wanted to only look at male, white non-Hispanics, I would just select those sliders and I could generate those results. Now, we're not seeing anything starkly different here, but just wanted to show you how to use the slicers. And if you come down here to the bottom of the page, you can see the suggested citation. So if you were to incorporate this data into a paper or a grant, you could pull the citation from here. And then you also see the query criteria. So you can validate what it is that you're pulling. So we're looking at male, white non-Hispanics in Nebraska, looking at the 15 leading causes of death. All right. So I'm going to clear out these demographics. And I want to show you how to use these group by, or these group results to structure tables. So we don't just have to look at 15 leading causes of death. We can look at any sort of subdivision of tables that we may want. So if I wanted to look at mortality by age, I could select 10-year age groups and run our table. And we could see what the mortality by each of these age groups is. So you can see here that the mortality is highest among those who are very young, so less than 1 year old, and those who are getting increasingly older, those who are 55 and above, 85 plus, our crude mortality rate is really high at about 15,000 per 100,000 people. We can also assess racial and ethnic disparities by combining race and ethnicity. And in structuring these tables, we can start to assess racial and ethnic disparities in mortality in Nebraska. So we can see that Black non-Hispanics have a mortality rate of about 745, and white non-Hispanics have a crude mortality rate of about 1,096. So this isn't exactly what I would have expected to see in these data. And the reason why is we're looking at crude rates. Now, if we wanted to, a crude rate is a rate that is unadjusted by other factors. So just the number of people who died over the total number of people in the population. But that's not really a great way to look at mortality. The best way to look at these is adjusting for age. Those who are older are more likely to die, right? So if we standardize the population based on age, we can actually see these true rates start to emerge. And when we process these results, we can see that the rates, the crude rate for Black non-Hispanics increased from 745 per 100,000 people to 1,023 per 1,000 people, while the rate in whites decreased from 1,096 people to 771 persons per 100,000. So we can start to see those racial and ethnic disparities start to emerge as we are going through these different data tables. All right, are there any questions so far? Anything that you'd be interested in seeing on either of these dashboards?
Don't be shy.
Yes.
Actually, my new friend, Priscilla and I, we're just talking about misconceptions and misunderstandings among the population that is not an English speaker.
Mhm.
And seeing some of those rates, I just wonder if a lot of that has to do, maybe it's a question that has not been asked, with not understanding instructions, like for following, taking medication or after surgery care, or you know what I mean. So trying to understand what is being told them and if they use an interpreter or not. And if an interpreter was present when they were given instructions or not, and was that interpreter a professional or family member? Because that can also play a big role on the result of the overall health of that person. So just seeing some of that, I know there is a lot in the picture and a lot of things that happen when it comes to healthcare. But when we were talking about interpreters and the role of interpreters, knowing that language is the power of your health.
Yeah, I would absolutely agree. Unfortunately, in these data sources that we have, we don't really have the ability to assess it, but it's definitely something worth looking into. Yeah, it's not really my area, but I can imagine that there would be some disparities present as a result of barriers to the language. All right. So we've gone through 2 of our 4 dashboards. And the next one is actually the easiest of the dashboards to use. It's Census Quick Facts. So Census Quick Facts very easily allows us to compare across different geographies. So these geographies can be states, they can be counties, they can be across the nation, but they can also be in cities and small towns that have greater than 5,000 people. So this very easily allows you to access information regarding population, demographics, housing, families and living arrangements, computer and internet use, education, health, the economy, transportation, income and poverty, and then business and geography. So a very powerful tool to get some crude rates for you to be able to get a picture of the populations that you're interested in using. So by default, the population that's selected is the United States. Let's go ahead and also incorporate Nebraska. Now, you can select a specific fact, is what it's called. Census Quick Facts, it's in the name, but these facts correspond to the different variables that you can pull out that you might be interested in. So if I were interested in the percentage of people who are white in Nebraska, for example, I could pull that information out, and that fact comes to the very top of the form that we're looking at. So we can see the proportion of people who are white in Nebraska is 87.3%. Well, it's only, well, not only, but it is 75.3% in the United States. Now, we can also create very easy visualizations by clicking on that chart button in the top, and we can see those differences in proportions visualized for us. So we can see the differences in a very nice bar chart. Now, you can go ahead and clear all of the information by clicking the clear button and start over from scratch. So I'm going to select Nebraska, and I'm also going to look at Douglas County. And I'm going to look at Thurston County. Now, Thurston County is a county that is in the northeast portion of the state, and this is home to the Omaha and the Winnebago tribes. So let's go ahead and select a different fact. let's look at college education. So we want to look at the proportion of people who have a bachelor's degree or higher. Now, if I visualize this information, you can see that folks in Douglas County are actually going to college and graduating with pretty substantially higher frequency than the United States. But in Nebraska, the proportion of people who are graduating with a bachelor's degree is a little bit smaller than in the United States. And in Thurston County, it's less than half of what it is in the United States. So we're seeing some pretty significant disparities that are emerging here using CDC Quick Facts. So clear this out. So like I was saying before, very easy point and click tool. This is the easiest of all of the tools to use. You really only have to input two pieces of information, the geography that you're looking at, and then the fact that you're interested in looking at.
I have a question about that data source.
Sure.
My dad's family is from Thurston County. Most of them are college educated, but they've all since moved elsewhere. And so how accurate are some of these things relying on when people move to the big city after graduating high school, go to college and stay in that college town or even move elsewhere? Do you see that being a larger factor when relying on these larger data sets? Taking those things into consideration when they're no longer there, but got that education?
Yeah, that's a really great question. So with any of these data sources, there's always going to be some degree of imprecision and bias that could potentially be involved. And I didn't show it in the BRFSS dashboard, but they actually put confidence intervals on each of their estimates. So in all of these data sources, what we're doing is we're sampling a smaller portion of the population, and then we're trying to make inferences about the larger population that there is. And the better the data source, the more precise your estimates are. So you're bringing up a really great example of the potential biases that are involved with some of these data sources. So what happens on a year-to-year basis when you have people entering and leaving certain geographies? And the answer would be you wouldn't really capture that at the time a person left. You would only capture it on a year-to-year basis. So these studies being conducted in 2023 are going to reflect 2023 data, in 2024, 2024 data, and so on and so forth. So if we're assessing at point A, which is January 1st, 2023, and you move February 1st, 2023, you're still going to be included in that 2023 data. So there is going to be some degree of imprecision. Other questions? That was a really great question.
Any other question?
Kendra.
To her point, there are.
I need you to put energy, so just for people.
So the data for the census is collected where you're residing at the time that the data is collected. So it doesn't matter what your hometown was, it's reflecting where you're currently living at the time of data collection. I believe there are some census questions that ask about like frequency of moving or moving in and out, like how long have you been at your current residence? And so you can kind of get some of the moving information, but it's not going to be as precise.
Yeah, absolutely. Great points, Kendra. Right. Anything else? All right, we're going to go on to my favorite of the dashboards, and that's because this dashboard is actually something that we've built in-house here at UNMC at the Cancer Center. It's called Cancer in Focus, and it focuses specifically on Nebraska-related data. Now, despite the fact that this is named Cancer in Focus, this isn't just purely a cancer-related dashboard. We've got a lot of data on social determinants of health, demographics, the environment, housing and transportation, disparities, cancer screening and risk factors, and then cancer incidence and mortality. And again, this is going to be one of our point and click dashboards where you can pull down any of these data elements that you may want very easily. This dashboard form is used in 26 different cancer centers, well, 27 including us, around the country. So it's a standardized dashboard. And like I said, this one is just applying Nebraska related data. So the first thing that you would do is select a geographic level. Are you interested in county level rates or census tract level rates. For our purposes, we're going to select county because we are going to be looking at some cancer-related metrics, and those are only available at the county level. But like environmental factors, if you were interested in looking at air pollution in parts per million, for example, that's something that's actually only available on the census tract level. So there are some limitations to the data. Some of them are only available on the tract level, and then some of them are only available on the county level. So we'll select county. And this is a dropdown that contains all of those different data elements that I talked about, the socioeconomics or sociodemographics, economics, insurance, environment, et cetera, et cetera. So we're going to look at cancer incidence. And when you're looking at cancer incidence and mortality, you're also allowed to select if you want to stratify by any races and ethnicities or any sexes. We're just going to leave those blanked out for now. And then we're going to look at lung cancer. So now we have a map that displays the incidence of lung cancer in Nebraska. Up here in the upper left-hand corner of the map, you're going to get the legend that's going to explain what it is that you're looking at. We're looking at cancer incidence per 100,000 people. We're looking at lung cancer, all races and all sexes. And then you get the specific data source that you're using in this legend as well. Cancer in Focus is so great because it pulls from a lot of different publicly available data sources, so you don't have to. So like the American Community Survey, CDC Places, CDC cancer-related statistics, all of these things are housed in one single location. So instead of me showing you 15 different dashboards, you can actually come to this one dashboard here and access all of those data that are available to you. Now, all of these maps are going to include the minimum value and the maximum value and include a color gradient that's going to indicate the level of incidence. You can also hover over each of these individual counties and get their incidence rates. So for Douglas County, the lung cancer incidence was 59 people per 100,000 persons. And then we can already start to see some of these darker areas emerging. Thurston County, from our last example, has an incidence of 91 per 100,000 people. So we're seeing almost a doubling of the incidence of lung cancer. Now you can also add different geographies and locations. So you could bold county borders, for example, if you wanted to. You could look at different food deserts within the state. You could look at the different interstates and highways. And then if you wanted to plot out where the campuses of University of Nebraska are, you could see them going along those highways. Now, the thing that I think is most interesting for this map is that by select tribes, we can see the Omaha and the Winnebago tribes up in Thurston County. And again, we can see those disparities start to emerge between American Indian, Alaska Natives, and then the rest of the state.
Dr. Maloney, you have a question in the back.
Yes, where do we got a question? Yes, all right.
Are you able to filter by congressional district so that different policy and advocacy efforts can use this map for advocacy?
That's a great question. We're actually looking into setting up different geographical units. So there's been some interest in getting the health districts that we saw from the first example superimposed over here on these different data sources. For congressional districts, the issue that we run into is that we don't have data that matches one-to-one, at least in these data sources, with congressional districts. That's not to say that those data don't exist, because they certainly do, but that might be something that we could look into for the future.
I just want to give a huge shout out. Gentry Barrett is here, and they have a map, All Things Nebraska, where they can do a lot of mapping like this, and there can sort by congressional district. So I don't know if it's worth the conversation with Nebraska Extension, but I think that'd be a really cool layer to be able to add to this map.
Yeah, I 100% agree. We can also look at lung cancer screening sites. Oh, we're frozen. Lung cancer screening sites if we want to. And we can see even disparities start to emerge in the places where lung cancer screening sites are compared to where different populations are located. Again, seeing a big urban-rural divide. We have many lung cancer screening sites in Douglas County and not many for the rest of the portions of the state. Now, we're probably interested at this point in looking at the current or the frequency in which people are smoking. Smoking and lung cancer go hand in hand, very well-established link. That's something that we can do very easily looking at this dashboard. So if we go to screening and other risk factors, we can look at those individuals who currently smoke. And perhaps unsurprisingly, again, in Thurston County, we see this big deep blue where everything else is a much lighter gradient. In fact, in Thurston County, the rates of smoking are about 35 to 40% higher than they are in the rest of the state. So very interesting. But right now, we're just looking at this in a univariate fashion. We've looked at lung cancer screening and we've looked at tobacco use. But in Cancer in Focus, we can actually look at these factors together and see how they relate to one another. So if we go to other apps and then select the bivariate tool, we can compare smoking and lung cancer at the county level. If it pulls up, there we go. All right. So you're selecting two different variables to compare here. We are going to select smoking, and then we are going to select lung cancer. And now we have a two-sided axis where as you move further to the right on the x-axis and further up on the y-axis, your color gradient gets more consistently dark. So that darker value is going to be where you're high in incidence of both smoking and lung cancer. And again, you can see in Thurston County, you have that really, really dark color starting to emerge, which indicates that there is a relationship. And if you wanted to quantify that relationship or get some more insights, you could click on the scatter plot function. And this actually charts out the incidence of lung cancer compared to the smoking rates, and will give you a best fit line. If the line is increasing, that indicates that there's a positive association. If it's decreasing, that would be a negative association. And we can very clearly see here that smoking and lung cancer are in fact related on this bivariate plane. Now, it's also worth mentioning that you can export any one of these visualizations that you may want. So if you wanted to export the scatter plot, you could download that plot as a PNG. If you wanted to download any of the univariate plots, there are links available to download the map, and you can also download the data. So this would give you all of those county level data for the metric that you're looking at, and you could download those in a CSV file that you could then analyze and look at. Now there's one more piece here. It's called the Cancer in Focus Profiles. And this allows you to get county level profiles that look at all of those different variables for you. So let's look back at Thurston County again. Now I could create a data profile, which would export this data table. So for all of Thurston County, I have all of the information on all of those variables that I've mentioned before. You can download those and you can analyze them if you'd like to. And it shows you both the value within the county, and then it shows you the median of all of the counties, so you can compare across. And then if you select the bar graph function, let's look at smoking. You can compare Thurston County to the rest of the counties within the catchment area. So in Thurston County, the proportion of people who smoke is 24.1%, where the median is 15.3%. Now, there's some excellent sources here along the top. The data sources list all of the different databases that these data are pulled from. You can link to any one of them and find out more information about the data if you want to. And then there is also an about page on Cancer in Focus that gives you more details on the dashboard. And with that, those are all of the dashboards that I wanted to show you today, and I'm happy to take any questions that you have.
Thank you. Are there any questions in the room or are there any questions online? Or if there's something you want Dr. Maloney to show you on Cancer in Focus that you're interested in seeing, we can do that as well. Yes.
Thank you so much for sharing those resources. Can you share with us maybe one or two projects that have been successful just by using those specific data sets or interventions that have been made based on this?
Yeah, for Cancer in Focus, we're just now starting to actually use it. It's been developed. It's actually only been posted and publicly available for about 2 weeks right now. But yeah, but but already we're starting to incorporate some of the findings that we've had in there into some of our public health messaging. Really, some of the things that we've been focusing on are those disparities between American Indian, Alaska Natives, and the rest of the state. So there's undoubtedly going to be some programming that's coming out of that, and we're introducing our collaborators to the dashboard, and they found it very useful thus far. But for all of the other data resources, I've used all of them in one way or another on applications or for papers. Really easy to incorporate those data.
Any other questions or any data you want to see from Cancer in Focus? Remember, it's 2 weeks, which is part of the reason why we asked Dr. Maloney to come, so we can have a new data source for you all to play around with after the institute. Gentry, yes.
This is really exciting. I really, especially like the correlation tables and things like that. I'm wondering if there are, my colleague Beth Nacky, where'd it go? She helps gather data on like access to healthy food and things like that, and wondering like are there possibilities to add more data into the dashboard from others, and how likely or how wanted that is, and maybe it already exists up there and I just didn't catch it, but what are their possibilities for moving forward for adding even more data?
Yeah, there are definite possibilities. The dashboard is pretty customizable in terms of the things that we want to add. And you can actually even add custom data. It's not a feature that I showed, but if you wanted to, you could add additional locations or map layers that reflect, if you had a data set, for example, you would put the proportion of whatever metric it is that you're looking at by counties, for example. That's something that you could upload and you could display in Cancer in Focus along with all of the other variables that are included in there. So if you wanted to do it quick and dirty in Cancer in Focus, combining those two different types of data, you could do it via this custom data tab. If it's something that we wanted to make more permanent, it's also something that we could integrate. The only thing that we have to be conscientious of is updating the data as it comes along, because Cancer in Focus itself actually has a web crawler that goes through and prowls for the different updated data, so it becomes available as it's updated on these different websites. So we would just need to update the file on an annual basis or whenever it is that they came out, but there's definite interest in adding those sorts of things.
We can connect the two of you.
Yes, that'd be great.
Any other questions, both online and in the room?
All right, well, I will leave it at that then. Like I said, we'll share this slide, and if you've got any questions, feel free to share my contact information along with the slides, and I'm happy to answer any questions that you have. But these dashboards are so easy to use with just a little bit of exploration. You can really get a hang of these. And like I said, all of these data become available to you very, very quickly as soon as you get familiarized with these dashboards.
Awesome. Thank you again, Dr. Maloney. Let's give a round of applause.